put him in a mental institution. They give him psychiatrists, therapists, but no one stops to say, could this be hormonal?
Yeah.
Could she possibly not be doing this?
Maybe she's not crazy. Join me, Sasha Pieterse, on Women in the Nude, Season 2, where we bear it all except for our bodies. Leave that to your imagination. Welcome to Women in the Nude. I'm so excited to have you here. I've been wanting to have you here forever. Everybody, this is Dr. Aliabadi, and I am so thrilled. I can't even tell you. I've been following you for so long. And I mean, I'm going to try and give you the best intro I possibly can. You are an incredible doctor. You are an incredible advocate for women. And you've been an amazing resource for me when it comes to my PCOS journey. And I'm so thankful that you are so active and vocal and are just fighting for change. And I admire you. I'm so impressed by you, all of the things. And I was honored to go on your podcast. And I'm so glad that you're here for mine. And I'll let you speak now.
Oh
Hi.
my goodness. You're so sweet. It's an
I mean
honor
it.
to be here. I'm so glad you got to come to our podcast. And I'm so glad, the reason I even post on Instagram, the reason I started the podcast is to, help women like yourself who don't get the information they need
Yeah.
from their physicians. And of course, I'm sure you know this, as women, we get dismissed when we go to the doctor.
Yeah.
Our complaints are dismissed. Every time we open our mouth, they tell us we're anxious, it's in our head, we're too nervous, So which is
PTSD right there for me.
right,
Yeah.
right. There you go. I
Sounds
mean, you
very familiar.
experienced it.
Yeah, absolutely. Absolutely, I did. And obviously, so many women I know did. Part of the reason I started this podcast. What made you want to be a gynecologist to begin with? Like women's health in general. What was your reason?
So many people ask me this, and the honest truth is that I did not want to see men. It's the truth. And I've said this, but
Sorry.
it's true. I did not want to have men come to my office.
Mm.
And maybe it's because when I was very young, I grew up in Iran and the revolution happened, and, my rights were all taken away from me. I had to cover my hair against my wish.
Yeah.
I have respect for all the women who want to cover their hair, but I didn't want to do it.
Yeah.
And I wasn't religious. And, I grew up in a country where we were suppressed. So I think naturally, when I came to America and I had this opportunity, I I almost wanted to stand up against that.
Yeah.
And to stand up against that was in a way standing up against men, subconsciously.
Yeah.
So when I went to medical school, I was left with one day I called my mom and I'm like, I don't want to do anything where men show up to my office. I just don't want it. Part of it is, I'm sure, related to this trauma
Yeah.
of my childhood. And so I was left between pediatrics and OBGYN. And I figured with pediatrics, I would not be able to operate, and I love to operate. So I went into women's health. And that's the real story. So I don't have some magical story of why I chose OBGYN, but
I think that's magical.
I love women. I have 4 daughters. The last one's adopted. People ask me, how come if you had 3 daughters, you went and adopted a 4th? I love women. And if I could adopt more, I would bring more women into my life.
I think that is actually a very special reason. And I say that because you are in turn a voice, like just women's health in general. We're not researched enough. There's not enough clinical studies. There's not enough resources behind it. And so you choosing that career path in itself is profound. Even if it was subconscious, or there was, a meaning behind it that was maybe coming from trauma,
Right.
it's still a valid reason, and it's a good reason. And you've helped so many women because of it.
And I love what I do.
It's
I
great.
mean, today I'm sitting here. I told you I had 3 major surgeries this morning. Then I ran to my clinic. I saw all these patients, and I'm doing this podcast. But I'm so satisfied. My heart is full.
It's so awesome.
So it's the best. I have the best job on the planet. I always tell my daughters, and they always tell me, they're like, Mommy, what are we going to do to love, our profession so much as you do? And I don't, it's lucky.
What a great role model you are, though, because I mean that ultimately is what they need. Being able to see you love what you do, they'll in turn find it, whatever it is.
Yes.
And it is such a great joy, just from like my own experience, being able to love what I do for a career is the
It's a
best gift.
gift. It's a gift.
Absolutely.
It's a
Absolutely.
blessing. It's a gift. It energizes me.
Mhm.
So even though I've had a day like that, I'm sitting here, I feel great,
Yeah.
gratitude.
Yeah, absolutely. What is your favorite surgery?
Laparoscopic hysterectomy. Big do you know what that is?
I recognize the last word.
Actually, I would say 2. I love laparoscopic endometriosis surgery because I'm
Mhm.
extremely good at it, but, the hysterectomy is when you remove a uterus. There are very few people in this country who can take a uterus out as big as a watermelon out of 4 tiny little incisions, and I'm one of them.
That looks insane.
So, my second case today was actually an extremely difficult hysterectomy, and when I finished it, the first thing I told myself is there's very few people in this country that could have done this as an outpatient, bloodless, in an outpatient surgery center, laparoscopically. So that's
That's incredible. It's a
it's an
superpower.
incredible for me, it's my superpower.
Absolutely. Um, that's wild on so many levels. And I'm it's exciting and also so crazy. Obviously that is a human that you're
Operating
operating
on
on. But what was your first surgery like? What was that? I mean,
my
that's so
first
crazy.
surgery ever was a C-section on a twin. I did my residency at County USC when County was like the second best program in the nation. It was one of the top but busiest hospitals in this country. And I remember as an intern, I walked in, my first rotation was my OB on labor and delivery, and the chief resident came up to me. She's like, "Are you the new intern?" I'm like, "Yes." She's like, "Go scrub. We have a C-section." I'm like, "Okay." So I thought I was going to go watch one.
Yeah.
I go to the operating room and she hands me the knife. She's like, "Cut." And I'm like, "Cut what?" Where do I cut?
Oh my gosh.
And believe it or not, I did it, and I think I did it in an hour and maybe 15 minutes, which is super fast for my first surgery. And, that continued, and I just made myself better and better and better. And I now have done thousands of deliveries and thousands of laparoscopic and other surgeries. So I've gotten really good at it.
Yeah.
It takes practice. You just have to keep doing it.
Yeah. Not something that a lot of people do.
No.
I mean, even with my pregnancy, I didn't have a C-section, but like when you think of the needle that goes into your back,
Yeah,
it,
the spinal needle.
yeah, it is wild when you see that. And I'm so glad I didn't see it. Like it's so
It's in your
great.
back.
Yeah,
Yeah,
exactly. That women don't see
exactly.
it because it is insane. It's
But,
like that
they numb
long.
your skin before they put the
Absolutely.
needle
No, I
in.
don't want to put
So,
any fear into
yeah.
any woman. That's not what I mean. It's just it's wild to go into a profession where you're doing something so crazy like that. It's not
But,
like a car where you can just,
the way
redo
I
it.
I I describe surgery, I don't know if you ski. Do you ski?
I snowboard.
When you snowboard and the weather is really nice and you're just coming down that hill and you feel so
Soft
good,
powder.
and when you get to the bottom of the hill, you just have that rush and feel so good.
Yeah.
That's how I feel after I finish a surgery.
Well, I mean, I bet there must be
It's
so many. It's like
so
an
satisfying.
dopamine rush in a way,
Yes,
right? Yeah.
yes.
Yeah.
So it's amazing. It's amazing. Like this woman, this giant tumor that I took out of her laparoscopically, it's going to change her life.
Yeah.
And I knew she's going to be in pain for a couple of days, but it's life changing. So that is such a great feeling.
Yeah. That has to be super rewarding. It's mind blowing to think that
I
you
know.
just did
Probably you think
2
I'm
things like
crazy
that. No, I
talking about
don't.
surgery like this, but
No, I don't. Well, I'm also so thankful that you
somebody's
feel that way
enjoying
about it.
it.
Exactly. Yeah, absolutely. I wouldn't want somebody doing it that didn't enjoy
Yeah.
it. But absolutely fascinating. I could talk to you about that all day. However, you have so many incredible things to offer. So I do want to get to PCOS and endometriosis and breast cancer. Obviously, there are a lot of things that women deal with their health issues. But I obviously have the connection to PCOS, but we always get questions here about all 3 of those things. And so you are such an expert on PCOS, all 3 of those, but PCOS. And what do you think helps you recognize it? Because I've been to, I went to 17 gynecologists and none of them got it right. None of them told me it was a possibility. I was misdiagnosed or dismissed, like you were saying earlier. Like what
Didn't you
made you
say
passionate about
17
it?
times?
17 times. Yeah.
That's crazy.
Yeah.
It's experience. When I first came out of my residency program, one, I was very well trained. I was trained at one of the top programs in the nation. So I already came out ready. I knew what polycystic ovarian syndrome was. I knew what endometriosis was, obviously not as much as I do today. But very quickly, I started seeing these patients. My passion for PCOS started in 20, maybe 10, when I started seeing a lot of the patients who would walk in with weight gain, acne, irregular period, hair loss, facial hair, body hair, mood changes, eating disorder. And one thing I noticed was that each symptom was being treated by a separate doctor. The dermatologist was
Mm,
dealing with the acne, the psychiatrist was dealing with the depression and anxiety and the eating disorder. Some other person was doing electrolysis for the facial hair.
right.
So these patients were going everywhere where the diagnosis was actually all under one umbrella. And that's when I started noticing how much women are getting dismissed because these patients, when I would say PCOS, they had never heard of it.
Yeah, I never did
You
when I
think
got my
it's bad right
diagnosis.
now? Close your eyes and think of 15 years
Yeah.
ago. No one knew what PCOS was,
Nope.
period. And a lot of times, even then, I remember to this day, I would diagnose someone with endometriosis, like let's say, I don't know, 20 years ago, 15 years ago. And the patient would not believe me because she had never heard of it. She would go get a second opinion and a third opinion. And the second and third opinions would tell her, no, you don't have endometriosis. No, you don't have PCOS. And these patients would come back to me. I never forget how one patient with endometriosis who came back to me, she's like, no one agrees with you. I don't have it. I don't believe it. And I was like, that's fine. I mean, you can't argue with patients. You
Right.
just give the information. And then I remember she left. She came back 7 years later to me when she was in debilitating pain
Mm.
and she was having fertility issues. And I was like, remember, like 7 years ago, I told you you had this? She's like, I know, but I went to all these other doctors that didn't agree with you. That's the problem with PCOS and endometriosis. And to this day, it's happening
That's
to
so
this
sad.
day because there's not a real blood test, not a real you can't just get an MRI or an ultrasound. With PCOS you can,
Can, yeah.
but it's really for endometriosis and PCOS you just have to listen to your patient. You don't
Yeah.
need anything to diagnose. My medical assistant's accuracy for diagnosing PCOS and endo is at 99%. They're so
Crazy.
good at it because I've been training them to diagnose PCOS. For example, you really need to look at 2 out of 3 criteria. The first criteria is history of irregular periods, right? Number 2 is PCOS looking ovaries on ultrasound. To this day, people think they need to have a cyst on the ovary.
Mhm.
Polycystic ovary syndrome is not cyst on the ovary.
Yeah.
It's follicles, right? It's a specific finding on ultrasound, but you really don't need to have that to get the diagnosis because number 3 on the list is symptoms of high testosterone. It could
Mm.
be acne, hair loss, facial hair, body hair. And, I always say if you're above 25, if you're older than 25 and you're still struggling with acne, it's PCOS until proven otherwise. If you
Yeah.
have hair loss at 25, you shouldn't have hair loss at 25. You shouldn't have scarring on your face. You shouldn't have facial hair, body hair constantly lasering your face.
Yeah.
Something's wrong, right? But because women get dismissed and nobody diagnoses them, they go through life not knowing they have it. So you need 2 out of 3 criteria. You can walk on the street. So PCOS patients, 75% of them are overweight, right?
Mhm.
Or if they're not overweight, they're really working hard at maintaining their
Yeah.
weight.
Drastic things.
Drastic. They
Yeah.
usually have mood disorder. They tend to be more anxious than other patients. They usually have someone in the family who's either diabetic, overweight, PCOS, insulin resistant. Pretty much every single one of us have a family member
Yeah, I
who's
was just about
insulin
to say,
resistant.
yeah,
I
yeah.
do for sure.
Yeah.
And these patients actually at a younger age, a lot of them can have an eating disorder. So I always say if you want to find young PCOS patients, go knock on the doors of these eating disorder centers. It's really sad. Instead of someone diagnosing them with PCOS and addressing their hormonal issue, what do? They put them in a mental institution, they give them psychiatrists, therapists, but no one stops to say, could this be hormonal?
Yeah.
Could she possibly not be doing this?
Maybe she's not crazy.
Maybe she's not crazy, but women are always crazy until proven otherwise. When you
Yeah.
go to the doctor, you are crazy until proven otherwise. A few days ago, I walked did I tell you this? I walked into an office, to see a new patient. As soon as I walked in, she's like, "Hi, my name is so-and-so." I introduced myself. She said, "I have one favor. Please don't call me crazy."
Yeah.
That's the first thing she told me.
Isn't that sad?
But that's what happens to women.
Yeah. And I told you this too, but an endocrinologist is who diagnosed me.
Yep. Isn't it
And
sad?
all she did was listen.
That's it.
All she did was listen.
That's all it takes.
And it truly is. And what you said about treating, 5 different things versus connecting them all together, I think so many women face that. I think you're spot on. Like, that is such a common thing where we're treating things feeling like they're isolated when that's not the case. And just so frustrating. I mean, all of it is just so frustrating. Part of why I have my podcast is because people feel like they're alone. And hearing someone like you, who is not only so trained, but also has, empathy and an eye for it and is actively doing things for it, it's amazing. And it's such a relief. And I know for me, with my own experience, it was so validating to just hear that I wasn't crazy, have people listen to me, and be able to talk to other women that were in the same position. And I have so many friends that have endometriosis, and it's devastating. And they're always finding out 5, 7, 10 years too late.
Or
And that's
if
what's
they get
devastating too.
diagnosed.
If they even get diagnosed at
Yeah,
all.
majority go undiagnosed for most of their life.
Yeah.
It's really, really sad.
Yeah.
And but I'm so proud of someone like you who uses, you use your voice to bring awareness to PCOS. There's nothing I want more than PCOS and endometriosis to be a household name.
Yeah.
People need to know what these two conditions are. We're not talking about some random, rare medical condition. We're talking about the top 2 causes of infertility for women on this planet,
Yeah.
right? 15% of women have PCOS and 10% have endometriosis, and about half of PCOS patients have endometriosis.
So that's what I was going to say. Like, how many PCOS patients also have endometriosis?
A lot.
Yeah.
Like 40%, I would say. And so whenever you see PCOS, you better make sure you're not missing endometriosis. And when you see endometriosis, you better make sure you're not missing PCOS. So not all endometriosis patients have it. Not all PCOS patients have endometriosis, but you have to make sure that you don't miss it.
Yeah, absolutely. I know the answer to this, but I want you to answer it. What can PCOS and endometriosis lead to if unchecked?
So very good question. Polycystic ovarian syndrome, it's a group of symptoms. So the symptoms are devastating, right? These are girls or women who gain weight and they're exercising, they're restricting their dietary intake. They are pretty much doing everything their thin friend is doing, but they're not losing a pound. It's really
Yeah, I
frustrating.
know.
That's
I'm
why
laughing because I know.
it's true. That's why they become bulimic, right?
Yeah.
Because they do everything the skinny friend is doing, but the skinny friend doesn't gain weight and they're gaining weight. I had a patient today. She's like, I walk 8 miles a day and I cannot lose 1 pound. Imagine how frustrating it is. That's why you end up going to the bathroom because they don't, you don't know. You think you're going crazy, not knowing that it starts with insulin resistance. And if we can fix your hormones internally, we can fix it. So treating the symptoms are very important. Weight gain, acne, hair thinning. Sometimes PCOS patients, when they lose a lot of hair, it's almost impossible to bring it back. You literally have to go to hair transplant. Whereas if you diagnose it early and prevent it, they'll never lose their hair. But fertility is the biggest issue with both of them. Polycystic ovarian syndrome patients have a lot of follicles. So when you do an ultrasound on them, or if you do an egg count, the doctor will say, "Oh my God, Sasha, you're great. You're, I don't know, you're going to be, I don't know, let's pretend
29.
I know. Let's pretend you're 39, right?
Yeah.
You go to your doctor and the doctor says, "Oh my God, there's so many follicles on your ovary." You're fine. You still have time. What happens with PCOS is even though you have a lot of follicles and your AMH, anti-Mullerian hormone, your egg count on blood test is really high, the quality of it starts going down at 30. So if we, I usually have the conversation about egg freezing anywhere between 28 to 30. I'll have my patients do it if they're not ready to have a baby or if they don't have a partner. Why? Because I always tell them, if you go to your fertility doctor and they say, why are you here? You say, I have PCOS and I'm here for quality, not quantity. So I even tell them what
Yeah.
to
The
say
right verbiage
so they don't,
matters.
yes, so they don't get dismissed. So they go in with a diagnosis. Now, endometriosis destroys your egg count and quality. I have a very dear friend of mine whose daughter at 14 has an egg count of a 40-year-old that I just diagnosed. That patient, had she not been my patient, she would have never been able to have kids.
Yeah.
Her egg count at 14 should be, let's say, her AMH should be, I don't know, above 4, above 6. Hers is 0.7.
So what did you do?
I immediately put her on birth control because she's so young, on a
Yeah.
progesterone-only birth control, and I'm going to freeze her eggs at 16.
Yeah, I was gonna say,
Yeah,
what
she
is that?
doesn't know that because she doesn't need to know that, but
Yeah.
at 16, we're going to
You're
need to
allowed to.
do it.
Yeah.
So, but endometriosis, as you know, is a condition that affects 10% of women, and cells that are similar to the lining inside the uterus or outside of the uterus, around the
Mhm.
tubes, ovaries, or inside the ovary. That's the most common place for them. And once a month, when the ovaries are secreting estrogen to get the lining of the uterus ready for pregnancy, these cells also get stimulated outside of the uterus because they think they're inside.
Mm.
And once we don't get pregnant and our lining, our uterine lining breaks down and,
Period. Yeah.
bleeds, these little cells on the outside also bleed. Blood is an irritant. You're not supposed to have blood outside of
Right.
your uterus. So it causes an inflammatory process. In a simple term, imagine like your body sends inflammatory cells to clean up that blood.
Yeah.
And that inflammation causes more bloating, more scarring, and
Yeah.
eventually it destroys your egg count and quality. You are never too young to have endometriosis. We have studies on 8-year-olds with endometriosis.
Yeah.
I've had 14-year-olds with stage 4 endometriosis. So, anyone, if you have a child at home, if you're listening, if you have a 10-year-old, 12-year-old who's menstruating and, if she has severe painful periods, they're on the floor, they're missing school, something's wrong. And I was saying this to a patient of mine today. It should be mandatory for pediatricians to start checking egg count on patients,
Yeah.
especially the ones who are complaining of painful periods, because endo really destroys your count and quality.
This brings me to my next question, which is, what advice would you give parents or mothers, as far as like what should they be talking to their daughters about as far as their health concerns go? Because like, how do you? I mean, a lot of women don't even know what's going on with their bodies as adults. How would you have your conversation with your daughter about how they're feeling?
So for me, I have 4 daughters, and being honest is the most important thing. 1. 2, do not dismiss your daughter. My patient today was telling me that for when she was very young, she was having really, really bad painful periods, and the pediatrician said, "Let me put your daughter on a birth control pill," and the mom said, "Absolutely not." Because if, parents think if you give your
Birth
daughter
control,
birth
she's gonna
control,
have
she's
sex.
going to have sex.
Yeah.
They're not going to go have sex. They're going to have sex regardless.
Regardless.
If they're going to want to have sex, they're going to have sex. They're going to find a way around it.
Yeah.
But my point is, she was so resentful today because
Yeah.
20 years later, I'm diagnosing her with endometriosis, and she's had 20 years of pain and discomfort and painful sex and all of it.
Yeah. Dismissed from people that she trusted that should have been there to protect her.
Right. But because women get dismissed, this becomes a pattern, right? Every time, and parents don't want to know that their child might have PCOS or endometriosis. So they rather not know sometimes.
Yeah.
So I had a patient a few months ago. She came to me. She's like, I want to apologize for her 4-month follow up. I'm like, why? She's like, I feel so much better after you diagnosed me with PCOS and endometriosis. But the first time I went home, my dad or my grandfather, who was a retired internist, primary care, when I told him that you had diagnosed me with PCOS, he replied by saying PCOS is a made up diagnosis. This is a physician, retired physician. That's how women get treated. So
Yeah.
imagine, so what I ask for parents is A, be honest with your children. B, don't dismiss their symptoms. C, chat GPT their symptoms.
Yeah. Isn't it amazing
Oh,
that that's
I love
helping? I
ChatGPT.
know I do too.
I want robotic gynecologists. I
Yeah.
really do. Because if you tell a robot, I have painful periods,
Yeah.
the robot won't tell you, go get some Advil and put a heat pack, and it's in your head. And I had, your grandma had painful period. I had painful
Yeah. That's
periods.
just what you got to live with.
Just none of it. If you tell a robot, if you tell ChatGPT, you will get the correct diagnosis.
Yeah.
And honestly, listen to SheMD podcast. That's why I
I
started the podcast. I literally go over every diagnosis, how to treat it.
Yeah.
I sometimes even give the dosage of medication in case there's any confusion.
Well, it's like we have to advocate for ourselves.
Yeah,
It should be like I go to the doctor, I tell them what I'm feeling, and they help me figure it out. But it's this constant like, no, I've got to fight to just have you believe me, which is the most frustrating thing. So when we can learn from you, when you have a podcast that, where you're talking about that, it's so helpful. And yeah, something like, Chat GPT where it's giving you information. I think there's also this misconception of when you Google something, it's, you're a hypochondriac and of course you got to verify the information and where it's coming from, but it's, you're just made to feel like everything is in your head and it's just really, really unfair.
it's changing though.
It
I'm
is.
hoping
Yeah.
it has to change. There's no
Well,
other way around
and
it.
you're helping it.
I mean, you're helping it. We together we can change it. We just have to unite as women. We have to
Yeah.
unite.
I know. So often we're fighting against each other, which is
So bad. And
so
you know
bad.
what? Think of it. I always say if men, let's take endometriosis, forget about PCOS.
Yeah.
If men had a condition that would make them stay home a few days out of the month, doubled over in pain or in bed, miss school, miss work, take pain medications, no results, and their sperm count would get destroyed. The quality of their sperm will go away. They wouldn't be able to have sex because it would be too painful. No, think about it. They would
I know,
get
it's so funny.
bloated. They would get bloated, and all they would have bladder symptoms. All of it, all of it,
Mhm.
and majority of them would go dismissed. Do you think?
No, we would yeah.
No,
It would not happen.
it would never happen. It
I
would
is
never,
Viagra
ever.
is like I think it's well, it's very much studied. I think erectile
Of course.
dysfunction is like
Yes.
overstudied
Yes.
at this point.
But it takes doctors 9 to 11 years to diagnose endometriosis, average age being around 32. But in my opinion, majority go undiagnosed.
Yeah.
But because of these podcasts, because of Chat GPT, now people are starting to learn more about it and they're starting to question
Yeah.
their doctor and their.
And you know, understanding what they should be saying, which is I think also like it's also teaching patients how to talk to your doctor and what to ask for and what to look for. But you started OV,
Yes.
and I mean I know why you started it, but if you want to talk about it and how you,
OV has been my passion for many years. In 2014, um, if there were a handful of doctors in this country prescribing GLP-1s for weight loss, I was one of them. And I was doing it all for my PCOS patients.
Yeah.
So I had patients in 2014 who would lose 50 pounds, 30 pounds, 60 pounds on Trulicity. Back then it was Trulicity. So PCOS and all the symptoms around it, from the acne, hair loss, irregular period, fertility issues, weight. I've been studying it for a very long time, and I used to hand so many different supplements to my patients. We'll take this, and then take 2 of these, and then take 1 of this one, and then add the vitamin D. And finally, when I met Mary Alice, and she saw how passionate I was about PCOS. Mary Alice is my partner in my podcast, and I'm so busy, I don't have time to do anything. And she said, if PCOS is your passion, what do you want to do with it? I said, one, I know how to create a calculator or a test that women can take for free. To basically, I can't diagnose someone online, but I can tell them whether or not they have the likelihood of having PCOS or not. So I said, I want my calculator, which I did it with her. And I said, for years, I've given so many supplements. I want to put everything together as one packet per day. And it took years to fix that. It took a
Yeah.
couple of years with a lot of different scientists. But finally, we really fine-tuned it. I love it. It's my baby. I don't think there is a supplement on this planet for PCOS better than Ovi. And I'm not, people who know me, they know I'm a terrible salesperson, but this truly is my life's mission. And I want to make a difference in the lives of all these PCOS patients. And, I wanted to have a supplement. So until doctors or robots start diagnosing PCOS and treating it, this supplement is an amazing alternative. And you can add it to your metformin, to your birth control, to all these other, to your GLP-1,
Yeah.
but it addresses it for hormone balance, for all of it. It's
Yeah.
amazing. And it works at a cellular level, which is, so it's been
Yeah.
my passion.
So I just started it, and I will report back. And I have a
Yes.
feeling that I'm going to absolutely love it. And I'm
Yeah.
so thankful that
I'm so
you've
proud.
made
You're
that
going to
your
love it.
passion.
You're going to love it. So a lot
Yeah.
of PCOS patients also have chronic inflammation.
Yeah.
So we have a lot of anti-inflammatories in it. We have antioxidants in it. It's overall, it has 16
Well-rounded.
well-rounded
Yeah.
for anyone with insulin resistance. I take it. I'm insulin resistant. I have an insulin resistance, but I don't have PCOS, but anyone with insulin resistance can take it.
That's amazing.
Yeah.
I also, there's in the last couple years, Ozempic has been like the topic, right? People taking it away from patients who need it. There's so many misconceptions and misdiagnosis and just in general, a lot of opinions around that. And I've seen a lot of women with PCOS get bullied for
Mhm.
taking something like Ozempic or the generic versions because they feel like it's cheating, which is, I think,
Tell him to call me so I can set him straight.
isn't that so cruel?
It makes me so upset. It
Yeah.
makes me wanna, it's so bad.
Yeah.
I started in 2014. Trulicity came out in 2014.
Yeah.
I started treating my patients.
Yeah.
It is life-changing. I get so upset when even doctors go online. That's the dangerous part
online.
of online,
Yeah.
Of social media, because anyone can have any opinion. Now, I'm not talking about patients with eating disorder using Ozempic to
Yeah.
lose 5 or 10 pounds. These GLP-1 medications, starting with Trulicity in 2014, they've been a game changer for PCOS patients. I have
Yeah.
patients that have lost 100, 140 pounds. These patients had no options prior to these medications.
Yeah.
Besides metformin, bunch of supplements, or gastric bypass,
Yeah.
Gastric sleeve. Really, really
Drastic options. Yeah.
options. And it's been a game changer. I get so happy. I used to go out. I'm Persian. I go to a lot of Persian events in LA,
Yeah.
and I used to be the littlest person because I've always been thin all my life. But now I go and I'm like the average size. And I always tell my husband, I'm like, nothing makes me happier because I know, especially my PCOS patients,
Yeah.
what a life-changing experience this has been. Because, one thing people don't understand, these medications are regulating their hormones.
Yeah.
They're not doing this to become skinny. That could
Yeah.
be part of it. Good for them. But they feel better. They feel better.
That's my thing is like, yes, you can see the result external. And I mean, correct me if I'm wrong, but it's so much of it is that it helps each other. When you lose weight, it helps your PCOS. It helps regulate
It regulates your
things,
period,
the
your
inflammation,
symptoms,
everything.
inflammation.
It's not just this like external, quick trick to fit in clothes that are smaller and to look good in your bikini photos. It is so much more than that, and it is so unfair to whittle it down to this superficial, Instagram war.
But you know what? I have a patient who's constantly getting bullied. She's a singer.
Yeah.
She's constantly getting bullied on social media, and it breaks my heart. She texted me a few days ago and she's like, look at the stuff people say about me.
Mm.
And as her physician, I just want to grab the mic and set everyone straight, but it's not my job to go on social media and attack people.
Yeah.
But it's really heartbreaking. And that's why I think the more we educate, the more we can stop the bullying online. It just
Absolutely.
needs to stop. It just needs to stop. And if they wanted, and anyways, my heart is full. I
Yeah.
will fight. I will bring awareness to this condition. It affects so many people. And I'm sure now when you walk on the street without talking to anyone, you can pick out
I
the
can pick it
PCOS
out. Yeah.
patients. It's
Yeah.
very easy. It's that easy to pick them out.
Yeah. No, it is wild. Just again, so many women that I knew who had it, who didn't say anything, or just in general by talking about it, by talking about my symptoms, got diagnosed because they knew what to ask for or realized that they had all very similar, symptoms and experiences. And I think what's important though too is that PCOS does look different on everybody. As much as
Yes.
there are so many common things that, to diagnose. Like I have a friend who didn't gain a lot of weight, but she had crazy period pain and a lot of gastro issues. And it turned out that she had PCOS and she was fighting a lot of, internal battles. And
That one, I want to make a comment about your friend too.
yeah,
But before we go there, I wanted to say you're absolutely right. So 75% of PCOS patients have weight issues. 25% of them, we call them lean PCOS patients. They're thin, but they
mm-hmm.
have acne, they have irregular period, they
Yeah.
have facial hair, body hair, they're moody, they have an eating disorder, they have all these other symptoms.
Yep.
So you don't have to be overweight. I'm also saying this to physicians because I
Yeah.
hear that all the time. You don't have to be overweight to be a PCOS patient, and you don't need to have a high testosterone in the blood to
Yeah.
get the diagnosis of PCOS. So please don't tell me, oh, well, I'm going to wait for my blood test results. No,
Mm.
because you can have PCOS with a completely normal testosterone level.
There you go.
So, on that note, with your friend, I was
Yeah.
going to say, you always remember that 40% of PCOS patients have endometriosis.
Yeah.
Endometriosis gives heavy, painful periods.
Mm-hmm.
And if over time, when you ignore endometriosis and you dismiss the patient and you don't treat them, and the inflammation increases in the pelvis month after month, year after year, eventually 85% of these patients develop SIBO. Have you heard of SIBO?
No.
Small intestinal bacterial overgrowth, which is leaky gut.
Okay. We hear a
The-
lot about leaky gut everywhere.
Well,
But yeah,
so
yeah.
these are patients who have the pelvic pain, they have the
Mm-hmm.
painful period, they constantly, it starts with bloating with their period,
Yeah.
and then it trickles down to a week after, a week before, and then all month. Every time they eat, they get bloated.
Yeah.
SIBO causes weight gain, fatigue, bloating. It can cause nausea, it can cause brain fog. It
Yep.
just, patients don't feel well on it. Where do they end up? In the GI office,
Right.
gastroenterologist. They see their doctor. They usually end up with an endoscopy, colonoscopy. If it's with a good doctor, they get diagnosed with SIBO. They get the antibiotics because we treat it with different medications, the most common being Xifaxan. We give it 3 times a day for 2 weeks. But these patients keep coming back. They're like, well,
Yeah.
I got treated and I'm not better. I got treated and I'm not better. Why do you think? Because the underlying condition, endometriosis, is
Yeah.
fueling their leaky gut. So that's why the GI doctor gets so frustrated. Like, I don't know.
I did what
I
knew
did
what
everything.
yeah, exactly.
So if you know that there's an 85% association between endo and SIBO, then when you have a endo patient, usually I operate, then I suppress with progesterone. And if they continue, I get rid of their pain. But if they come and say, my pain is gone, but I'm still bloated, then I know I have to treat their SIBO. Then you can treat their SIBO. Does it make sense? To your
Yeah.
friend
Yeah.
who has GI issues and
Yeah.
painful period, make sure they're not missing endo and SIBO.
She had healthy twins.
Good.
But I will report that to
By the
her.
way, half of endo patients still get pregnant.
Yeah.
Yeah. It's only the older you get,
Yeah.
the less suppressed you are, the more you're at risk. Let's
Yeah.
say if you start birth control because you don't want to get pregnant at age 20 and you stop it at 25 or 27, let's say, and then at 28, 29, you want to get pregnant, you're probably going to get pregnant because that birth control pill completely suppressed your endometriosis during those years. So
That's
it
really
all
interesting.
depends. So please don't come and tell me birth control made me infertile.
That is okay. So I've always heard that, you take birth control for 15 years and then you can't get pregnant and it's the birth control's fault, but it's not.
So very good point. If you take birth control continuously past 7 to 10 years, a small percentage of women can have chronic suppression of their ovarian reserve. What does that mean? that if you take birth control continuously for 10 years and you suddenly stop it, it can affect your, in some patients, your egg count. So what do? If you're on birth control, I think everyone needs to get their egg count checked every single year.
Yeah.
But if your doctor's not doing it, then at least after 5 years of birth control pill, check it. Then at 6 year, check it again. At year 7, check it again. And if it's staying consistent, fine. But if you see a drop, then you need to come off.
Then you know that you're one of those people.
Yes,
essentially.
but it's not very common. So that's the only drawback of staying on it, on it long term. But I was on mine for 9 years. And when I stopped it the first month, I got pregnant. But I took it not for endometriosis and not for PCOS. I took it because I didn't want to get pregnant.
Right.
For patients with PCOS and endometriosis, a lot of them get treated with birth control pills, right? But the underlying conditions are endo and PCOS, the top 2 causes of infertility. So they take the birth control for 5 years. Then 2 years later, they want to start trying to get pregnant. They don't get pregnant. They blame the birth control.
Right.
But it's the underlying condition that's bothering them. So for endo, actually, birth control pills can save your fertility.
Right.
And save your egg counts.
So those are things that I didn't know.
I can talk until tomorrow. There's so much I want to share with you.
No, I know. I'm so glad.
anyways.
And you can come back anytime. But I mean, that in itself, everything that you just said is extremely helpful. And I know if anybody hasn't seen SheMD, they'll learn something here today and they need to listen to your podcast. Because
I was going to say, please don't come to my office. You don't need to see me. I don't have time.
Well, I will say, I wish you were my doctor. I wish
you can
that's,
come. You can come. You should come
I wish
see
I
me.
knew about you.
But really, I started this podcast so people don't have to come to my office anymore. I don't want people to come because I give all the information on SheMD.
Yeah.
We have episodes on PCOS, on endometriosis, on breast cancer, on brain health, on everything women's health related.
Thank goodness. I so appreciate you coming here today. Thank you for sharing with me. I can't wait to report back on OV and
can
to
I
keep
say
this
2 more
conversation going.
things
Absolutely,
before we go? Because I
Absolutely.
cannot leave without talking about 3 things.
Do it, please.
Number 1,
Yes.
know your egg count.
Yes.
Ask your doctor. It's a simple blood test. It's called AMH. Make sure you don't have painful periods. Make sure you don't have polycystic ovarian syndrome. As a woman, as soon as you turn 18, you need to check all of this.
Yeah.
But for all women, for all the moms listening, every single person on this planet needs to know her lifetime risk of breast cancer.
Yes.
I don't want to leave without saying that
so glad,
because it's
please.
so important. So as you know your first name, your last name, and your date of birth, you need to know what your risk of breast cancer is. 85% of women who get breast cancer don't have anything in their family. Less than 5% of breast cancers are genetic. So majority of women who get breast cancer are just like me. I didn't drink, didn't smoke, didn't use drugs, didn't have family history, didn't have any gene mutation. I was a vegetarian for 7 years, but I got breast cancer. Know your lifetime risk of breast cancer. Your family history, your height affects it, when you got your period, when you go through menopause, whether you've been on hormones, whether you're Ashkenazi, all of it. You have to add it in. It's on SheMD. It's a Tyrer-Cuzick formula. You punch in your information, the density of your breast, all of it, and it gives you a number. That number is very important. Less than 15%, you're in the low risk category. If your lifetime risk is 20% or more, you fall into the high risk category for breast cancer, which means you need breast imaging regularly. Mammogram, ultrasound, and MRI starting at age 30, not 40. So knowing your lifetime risk is very important. And the last thing I want to say before we end this is every single person with any family history of cancer, they need to take a genetic cancer test. It's covered by insurance. If it's not covered by insurance, it's only $249. It can save someone's life. If you have family history of prostate cancer, pancreatic cancer, colon cancer, ovarian cancer, any cancer, ask your doctor for genetic cancer testing. I use the MyRisk test by Myriad. Because it not only calculates your Tyrer-Cuzick, your lifetime risk, it also looks for little tiny markers in your DNA that can push your lifetime risk higher than what it is just by history. So I never, because I had breast cancer, I never want to leave a podcast without talking about genetic testing and lifetime risk of breast cancer.
I'm so glad that you shared that. I'm going to go, first of all, I'm going to use the calculator and I'm going to go do that because I feel like
do you have any family history?
I do. Yeah. Yeah. My both sides, lots of diabetes. But my grandfather on my mom's side had pancreatic cancer, and my grandfather on my dad's side had brain cancer.
Okay, so
Um,
insurance will pay for you to do the MyRisk test. Just
okay.
do it. You don't even 90 some percent of my patients get covered. You know why that's important? Because pancreatic cancer can also sit with breast and ovary. It can
Great.
sit with kidney. It can sit with, they can be on the same DNA mutation. So you need to double check. And it's not just BRCA, they check for 48 cancer causing genes. They calculate your lifetime risk of breast cancer and they give you the risk score, which is your history, your Tyrer-Cuzick, plus those tiny little markers that I was talking about. So you get 3 information from your Myriad test. You should come see me.
I would love to see you.
Yeah.
Okay.
Anyways,
Great.
thank you for having
Thank you
me.
so much. Thank you for sharing so much information. And I'm going to link everything. And
You're so sweet.
you're so sweet. I'm honored, truly.
Mm.
Thank you.
Thank you for having me.
I appreciate you so much.